Right guys, welcome to my YouTube channel, and in this video I am going to discuss INICET grand quiz which I had posted today in my Telegram group. The link to my Telegram group is given here, it is being shown here. I am also displaying my Instagram handle, and if you are not able to find my Telegram group, you can simply come to my Instagram account, and there I have put up a link of my Telegram account. Yes, okay. Now the idea of having this quiz is to cover some PYQs, some PYTs, and side by side give you some new questions, right? And in this video I am going to be very crisp, very concise, so I won't write much, but I will speak more, so that once you watch this video, so you get some relevant information in 10 to 15 minutes of our discussion, right? Okay, now without wasting any more time, let's start with the very first question. A 65-year-old patient is taken for cataract surgery. After 3 weeks he developed endophthalmitis. What is endophthalmitis? Endophthalmitis when there is inflammation of the choroid, retina, vitreous humor, aqueous humor, lens zonules, excluding sclera, है ना? So this is endophthalmitis, and of course the Tenon's capsule. So the most common source of organism leading to post-operative endophthalmitis after cataract surgery is, right? So पहली चीज ध्यान रखेंगे, do you know that whenever we perform cataract surgery, we do draping with which solution? We use solution 5% povidone iodine. This is your previous year FMG question. It was asked last year in December 2023 exam, which happened to be in January 2024. Yes, so December 2023 session exam. So 5% povidone iodine. Why do we do that? Because we know that the most common source of organism causing post-operative endophthalmitis is nothing but the patient's eyelid. This is your second question. So in FMG, two questions were asked back to back. One was which is the solution which is used. Second is that which is the most common source, most important source. So that is your patient eyelids. Yes, okay. Now moving over to the second question. What is this? Oh my, this image has been repeated 1,000 times. So this is 1,001st time which you are seeing this image. Yes, so this is a typical appearance without even reading anything, so you know this is splash tomato appearance. But anyway, we have to read the question, we have to go through the history. 17-year-old female is the risk factor, main etiology for one disease, which is this. Yes, and sudden painless loss of vision 6 hours back. So sudden painless loss of vision in CRVO, in CRAO, in vitreous hemorrhage. So there will be painless loss of vision because retina के अंदर pain carrying fibers नहीं होती. Yes, the patient gives a history of sitting in a room when he felt as if suddenly the voltage dropped down. So see, if the voltage is getting dropped, right, so you will suspect CRVO. If the patient comes to you and say, Doctor Sahib, I was sitting in the room and suddenly I felt as if the light has been switched off, you will think of CRAO. But in CRAO, the retina will be pale, milky white, cherry red spot will be there, cattle tracking will be there. Yes, but here UT, which you see, not T, C, which appearance? It is splash tomato appearance. Yes, and the answer is clear cut, which is CRVO. Now your NEET PG 2024 question, in vitreous hemorrhage, what happens? This was also asked in a twisted way in your INICET 2024 session. Yes, okay, INICET 2024 June session. Okay, vitreous hemorrhage. So in vitreous hemorrhage, the red reflex will be absent. Red reflex will be there. If you have attended my class, I typically show you the absent red reflex in a patient with vitreous hemorrhage. So remember, I had used my mobile phone to capture the patient's video. So I took a direct ophthalmoscope, put my mobile phone at the back with camera on, and I try to show you the red reflex. You know what is red reflex? When you take photos with flash, you see red in the eyes, you call it as red eye. That is actually the light which is striking the retina, it is being reflected back, that gives an appearance of red reflex. So that is absent in vitreous hemorrhage. Yes, okay. Patient came with left head tilt. He gives history of diplopia increasing on going downstairs. So when you go downstairs, you see like this na, you're not going to see like this while walking downstairs. Tick 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 tick, hai na? Okay, so when you look down, so you are going downstairs. Yes, so when you are looking down, two muscles help in what? Depression. Which are those two muscles? One is your superior oblique, second is your inferior rectus. So that actually tells you that either of these two muscles is involved, superior oblique or inferior rectus. Now there is compensatory head posture which is given. Patient came with left head tilt. So I always tell you in my classes that the compensatory head posture of the patient is always in the direction of action of involved muscle. So what is the primary action of obliques, my dear friends? So primary action of oblique is intorsion. So if there is left head tilt, that means this is the compensatory head posture of the patient. So in this compensatory head posture of the patient, the right eye is getting intorted. So that actually tells me that the muscle which is helping right eye to intort is getting affected. So the answer is clear cut. It is right superior oblique. So this is a very important conceptual question from the chapter of squint. Right superior oblique is the answer, boys and girls. Okay, so preferred formula for IUL calculation in a patient with axial length means small axial length. What is the normal axial length in adults? 24 mm. Yes, okay, so small axial length if we are talking, so the answer is pretty straightforward. It is Hoffer's. Otherwise, if the axial length is normal, which is say 22.5 to 24.5, so the formula is, what is this formula? It is SRK second generation formula. Yes, okay, so there are two other formulas, Hagee's and Holaday's formula. Yes, and Holaday, if the axial length is more, latent period of photoophthalmia is how many hours? Photoophthalmia is after the exposure to UV rays. So there is desquamation of the corneal epithelium, and after exposure of typically 4 to 6 hours, so the patient will complain of redness, watering, blurring of vision, pain, conjunctival congestion. For that, what will be the treatment? You can give oral non-steroidal anti-inflammatory drug, Combiflame, paracetamol, diclofenac, right, ibuprofen. And the treatment of this desquamation of the epithelium is you simply patch the eye. Patch the eye for how long? 12 to 24 hours. You will patch the eye for 12 to 24 hours. Yes, there will be epithelial regeneration. Why? Because you know at the limbus there are palisades of Vogt. So palisades of Vogt has corneal limbal stem cells. So they will move and will cover the area of the cornea which is desquamated. Yes, so that is photoophthalmia. I have compiled the entire photoophthalmia in this question for you. It is also known as snow blindness. You must have seen welders using a special glass while welding, because to prevent photoophthalmia, because there is intense UV rays which come from the welding. Also, not to forget, there is another condition, that is photoretinitis. Photoretinitis is due to exposure to infrared rays, and that is irreversible. The infrared rays especially seen in solar eclipse. If you will see the solar eclipse with the naked eye, the infrared rays are going to hit the retinal pigment epithelium and it is going to damage it. It will lead to irreversible loss of vision. Yes, photoretinitis, boys and girls. This is photoophthalmia. Okay, Stargardt disease, true is all except. So Stargardt disease, there is another disease, Best disease. This is a part of macular dystrophy, and Best disease and Stargardt disease is dystrophy of which part of the retina? Can you tell me? Dystrophy of which part of the retina? So dystrophy of retinal pigment epithelium, dystrophy of retinal pigment epithelium. Yes, so in this case you will typically see dark choroidon, fundus fluorescein angiography, snail's time appearance of the macula is seen. So the typical presentation of Stargardt disease is less than 21 years, while if we talk about Best disease, it is at approximately 6 years. So that is one major difference between Best disease and Stargardt disease. I am just quickly going to compile. So Best disease, in early stage there is no loss of vision, which is egg yolk. You will see egg yolk appearance at the macula. Yes, but in late stage there is loss of vision. In Best disease there is scrambled egg appearance, while in Stargardt disease there is early loss of visual acuity, early loss of vision. In Best disease, signs are more than symptoms. In Stargardt disease, symptoms are more than signs. Yes, okay. In Best disease, there is one investigation which is abnormal, and that investigation, boys and girls, is electrooculogram. So electrooculogram is abnormal, है ना? And in Stargardt disease, it is written normal EOG and subnormal ERG. So EOG is normal in the beginning, even ERG is also normal in the beginning, and later both will be abnormal. ERG and EOG may be abnormal, right? But in Best disease, EOG is abnormal but ERG is normal. ERG is normal. And presentation, I have already told you, less than 21 years, so it goes in favor of childhood, you can say child, है ना? And adolescent presentation, right? So the answer to this question is normal EOG and subnormal ERG. It should have been, true statement should have been normal EOG and normal ERG, but in late stages EOG and ERG both can be abnormal. Okay, universal marker of limbal stem cells is, it is pretty straightforward, it is ABCG2. No more discussion on it. Okay, most common complication of hypermature sclerotic cataract. You know there are different stages of senile cataract. Yes, stage of lamellar separation, then we have got immature stage, mature stage, hypermature stage. Yes, so these are important stages that you should be aware of. And in immature stage, you know there is a typical diagnostics feature which is half moon shaped shadow which is seen, है ना? Stage of hydration, stage of lamellar separation, then immature stage, then mature stage, then hypermature stage. In hypermature stage, the lens is milky white in color. The lens is milky white in color and becomes heavy. There is liquefaction of the cortex and the nucleus becomes heavy. It falls down in Morgagni's hypermature cataract or in hypermature sclerotic form. Hypermature cataract can be of two types. One is Morgagni, yes, and another is sclerotic. In sclerotic, the nucleus become very hard, right? And it may attain red color, you call it as cataracta rubra. It may attain black color, you call it as cataracta nigra. It may attain brown color, you call it as cataracta brunescens in Morgagni. So the cortex is liquefied. Cortex is liquefied and the nucleus falls inside the cortex, है ना? In both the cases, because the lens is becoming very hard and heavy, so there may be breaking of the zonules of the lens that may lead to subluxation or dislocation of the lens. Some of you may be thinking, sir, why not phacomorphic glaucoma? My dear friends, phacomorphic glaucoma is associated with mature cataract, not with hypermature cataract. With the hypermature cataract, there is association of phacolytic glaucoma, typically seen in Morgagni's type. Yes, okay. Next question, drug contraindicated in iridocyclitis. Atropine and steroids, they are usually given in anterior uveitis, which is iridocyclitis. Iris and pars plicata of ciliary body, steroids are drug of choice, and atropine is mydriatic agent which is given to decrease the pain, to decrease the spasm of the muscles. Which muscles? Ciliary muscles. Aspirin has got no role, my dear friend. Pilocarpine cause uveitis, because it can cause ciliary spasm, and there is already ciliary spasm due to inflammation of the pars plicata of ciliary body, ciliary muscle spasm. So pilocarpine also causes ciliary muscle spasm that may cause uveitis. That is one side effect. Pilocarpine was earlier drug of choice for primary angle closure glaucoma. Now the drug of choice for primary angle closure glaucoma is prostaglandin analogs, which is latanoprost, travoprost, bimatoprost, tefluprost. Even for primary open angle glaucoma, the drug of choice is prostaglandin analog. Even for normotensive glaucoma, the drug of choice is prostaglandin analogs. I hope you have got all these important PYQs. Okay, wonderful. Next is, which is not an absolute contraindication of corneal transplantation? I always enumerate the important contraindications of corneal transplantation. I am quickly going to speak. If you want to write it down, just note it. One is rabies, hepatitis B, hepatitis C, hepatitis A. The new addition is COVID-19, then HIV, death from unknown cause, septicemia, Kuru's disease, Creutzfeldt-Jakob disease, prion disease. Yes, and of course, SSPE is also the absolute contraindication, that due to unknown cause. Yes, rabies, yes, but the answer is here TB meningitis is not the absolute cause. So here the answer is TB meningitis. है ना? All right, so these are important points that you should know, the points which I just told you. Which of the following anti-glaucoma medication can cause dryness? Okay, what are the side effects of latanoprost? Yes, trichomegaly. Yes, it causes trichomegaly. It can cause cystoid macular edema. It can cause iris hyperpigmentation. Iris hyperpigmentation. It can even cause uveitis. These 4 side effects have been asked multiple times. Timolol, your previous year question, non-selective timolol, which is of course non-selective beta blocker. Timolol is non-selective beta blocker. It can precipitate the attack of asthma. Dorzolamide can cause corneal decompensation, that is corneal edema. But brimonidine, it can cause yes, depression in adults. And it can cause apnea in children. Why it can cause apnea in children? Because it has the ability to pass through blood-brain barrier. Why? Because in children, in newborns specifically, the blood-brain barrier is not fully developed, so it is able to pass through underdeveloped blood-brain barrier and suppresses the respiratory center, causing apnea. And the answer to this question is also brimonidine. It can cause drowsiness. Okay, today only a patient had come to me, Auntie Ji, with the complaints of glaucoma, and she was using brimonidine, and she said, Doctor Saab, whenever I put brimonidine, I don't know, I had developed some sort of anxiety, some sort of stress. I also feel very sleepy. I keep on sitting on a chair and I sleep. And when I checked her drugs, one of the drug was brimonidine. I stopped brimonidine and I put her on dorzolamide. So this is what happened today, the real case scenario. Okay, band-shaped keratopathy is caused by, so in band-shaped keratopathy there is deposition of calcium and phosphorus where? At the Bowman's layer of cornea, and it is one of the complications of anterior uveitis. So I told you calcium and phosphorus, so calcium is there in the answer, in the option, so you are going to mark calcium. Okay, a patient presented with unilateral proptosis which was compressible and increases on bending forward. No thrill or droop was present. MRI shows retroorbital mass with enhancement. So see, if there is presence of orbital varix, orbital varix, and if the patient goes in prone position, so due to gravity the blood will get collected here, and as a result it is going to push the eyeball below, so the patient will have proptosis. But when the patient will lie supine, due to again gravitational effect, the blood which was collected behind the eyeball will get drained off, and as a result the eyeball will go back in the orbit. This type of proptosis is known as your intermittent proptosis, and of course this type of proptosis is compressible because there is fluid now, so you compress it, so you are going to reduce the proptosis. So the answer is pretty straightforward, orbital varix, yes, And don't get confused, if there will be AV malformation, there will be brute will be there, है ना. And if we are talking of compressible swelling, so orbital encephalophyll, it may not be compressible. Yes. Okay, so the answer is orbital varix. Neurotrophic keratopathy treatment is all except neurotrophic keratopathy is due to damage to fifth cranial nerve, which is trigeminal nerve. You know, whenever something hits the eye, so there is blinking now. So whenever something hits the eye, it is going to stimulate the subepithelial plexus of nerves, which is a branch of long posterior ciliary nerve. Listen carefully. Which is further a branch of nasociliary nerve, which is further a branch of ophthalmic division of trigeminal nerve, which is itself is fifth cranial nerve. So that forms afferent pathway, and the efferent is via seventh cranial nerve, which causes contraction of the orbicularis oculi. There is blinking. Yes. Now if there is damage to fifth cranial nerve, one, the blink reflex will be absent. Second is, you know that in the nerves, because the fifth cranial nerve is damaged, so the long posterior ciliary nerve, its branches subepithelial plexus, है ना, will not have its effect. So we have got NGF. What is NGF? It is nerve growth factor, and it is very important for epithelium replenishment of the cornea. If there is damage to fifth cranial nerve, they will not secrete nerve growth factor. As a result, if there is any damage over the surface of the cornea, the epithelium will not be replenished via palisades of Vogt that we just discussed, the limbal corneal stem cells. As a result, it is going to form epithelial defect along with infiltration or inflammation, which you will call it as corneal ulcer. Yes. So what will be the treatment of this condition? So one, you cover it with the amniotic membrane. Amniotic membrane will provide some moisture, it will provide some extra covering. So yes, that can be the treatment. Tarsorrhaphy is you suture the upper and lower eyelid, which closes the eye and prevents the further drying of the cornea, leading to inflammation. Yes. And inflammation can further lead to development of corneal ulcer. So it will give some time for the raw epithelium desquamation to get healed, because the eye will remain covered. So it will be acting like a natural bandage. Yes. Tarsorrhaphy, topical lubricants. Again, lubricants will actually help in providing some lubrication so that the upper eyelid does not rub upon the cornea, and as a result it may not further lead to damage of the corneal epithelium. Whenever you travel in a car, if the windshield is not if it is dusty, if it is not clear, so you pull that small part of handle towards you na, which will first throw water on the windshield, and then the wipers will move. If you don't pull it, if you simply start the viper will move over dusty windshield, and it may put scratches over the windshield by rubbing over the dust over the windshield. Yes. So lubrication is very important. So the answer is RGP, contact lenses, rigid gas permeable. The contact lenses are rigid, so they are further going to rub over the surface of the cornea and further leading to damage to the corneal epithelium, which may further deteriorate the condition. Okay, last question. Most common carcinoma causing intraocular metastasis in females. इसका मतलब ये है कौन सा कैंसर है जिसका मेटास्टेसिस मोस्ट कॉमनली आंख के अंदर जाता है फीमेल्स में. सो द आंसर टू दिस इज प्रिटी स्ट्रेट फॉरवर्ड. इट इज एक्चुअली द CA breast. So breast cancer is one cancer whose metastatic cells will enter most commonly in the eyeball. All right, so boys and girls, so these were all 15 questions. I have tried to touch the related points so that it becomes very crisp and very high yielding in the end. So all the best for your INICET exam, and yes, let me know how was your exam, and I'll be waiting for your inputs. Best wishes from my side. This is Dr. Manish, your ophthalmology educator, signing off now. Bye bye.